Welcome to the Misunderstanding Dementia Show. This episode is brought to you by the Alzheimer's Disease and Dementia Care Seminar, the required course to be a certified dementia practitioner. Check out our website at drmikechua.com/ADDC. Enjoy the show.
Hello everyone, this is Dr. Mike Chua, physical therapist and certified dementia practitioner, and today I've got a special guest. I've been trying to catch him, and now I have him here. His name is Dr. Carr. He's actually one of the awesome physicians here in our area. So we're just here to ask him some questions, where he got his degree, where he's originally from, and then learn from him today. So again, thank you very much, Dr. Carr. I appreciate you. So where are you originally from, sir?
Thank you for having me here. I was born and brought up in Geneva, Ohio, which is 50 miles east of Cleveland and 3 miles south of Lake Erie.
Okay. So I was reading your what do you call this card here. You finished your undergraduate here in the University of Tennessee, sir?
Yes, the night I graduated from high school, my family moved to Martin, Tennessee, where my stepfather's from. And in the fall, after high school, I enrolled in UT Martin and had good success, and eventually in the medical units in Memphis, University of Tennessee Medical Units in Memphis, and completed a residency in family medicine at St. Francis Hospital, Memphis, and I've been board certified in family medicine ever since 1978.
Oh wow, 1978. That was the year I was born. Thank you very much, Dr. Carr, for all the service you've done. So what made you really decide that you wanted to be a physician, sir?
Well, there's instability a bit in my family, if you will. My father was a factory worker, my mother was a waitress, and I decided I wanted to get into something that would have stability, that wherever I ended up going, I would have a job. And I found myself at UT Martin making grades better than those people going to medical school. I thought maybe I would be a dentist at one time, but since my grades got better than their grades, then I decided I would go into medicine, mostly simply for the security of having a job.
Well, you heard that. It's all about the grades and about the job security and everything. So, and thank you for choosing this awesome field, sir. You are serving a lot of people in this community, and I've been seeing some of your patients at the nursing home, and also previously at the hospital, and your patient just really loves you, sir. So thank you very much for all you do. Well, this show here is all about dementia, so we're going to ask Dr. Carr because he goes around different nursing homes. He's actually the medical director of different nursing homes and facilities here. So we're going to ask Dr. Carr about dementia today, sir. So what are the most common types of patients do you see in your practice, sir, here in your clinic and also in the nursing home?
Well, as you say, I'm medical director of the Weakley County Nursing Home, the Obion County Nursing Home, the Ayer Nursing Home, and the Unity Gerald Psychiatric Hospital here in Martin. Of course, all of these institutions are related with dementia. As a family physician, though, I'm not able to bill for dementia. So when you ask the most common disease I see, nursing homes, when I first encountered them, you would see people walking in the hallways, people who lived in nursing homes. This day and time, that's very unusual. The vast majority of persons, if you go to a nursing home and you are in the hallways, you will either see people in wheelchairs or people will be in their beds and not really able to be ambulant, even be in a wheelchair. So the dementia is profound, and the most common thing that I deal with, I got to thinking about, is multi-organ system failure. In this day in medicine, in which so many people specialize in heart disease or lung disease or kidney disease or bone disease, brain disease, I sometimes think how fortunate it must be to just have one area of medicine. Most of the people that I deal with don't have a heart condition. They have a heart condition, a lung condition, a kidney condition, plus dementia on top of it. And this, of course, makes these the treatment for these people rather challenging, because you'll only get so much from the heart and so much from the lungs and so much from the kidneys and so much from the bowel, and you have to balance all those out. And so I spend most of my time balancing those things out.
I don't know if you heard what Dr. Carr said. He said he's dealing with multi-organ disorder or syndrome. And that's what you want to look at. When you're looking for a physician, you want to look at a physician that is actually looking at you as a whole person, not just specific for the knee, specific for the shoulder, specific for the heart. Yes, we go to a specialist, but if you want to be treated as a whole person, you go to somebody who can see you as a whole, because like what Dr. Carr said, your heart can only do so much, your kidney can only do so much, and it needs to be balanced out. So thank you for pointing out, Dr. Carr. So you mentioned about multi-organ. So when you talk about that, which body part do you normally immediately check when you have a patient like this, or do you just, obviously you go there, listen to the heart and stuff like that? What's the initial protocol that you follow, sir?
Well, obviously the heart is the trump card of medicine.
Mm-hmm.
If something happens to the heart, you have to intervene on it acutely and abruptly, and sometimes very forcefully. So that is always first and foremost. You don't have another day or another week to contemplate the other things that get involved. Kidneys, lungs, the brain, the bones, the bowel. Those you can think about and deal with in a more ongoing fashion. People who transfer to a long-term care facility, say from an acute care hospital, the first thing you do is to look over the medications they're on for congestive heart failure or post-myocardial infarction. So I would say that's probably the first thing one looks at, see how much one can expect functioning from the heart that's there, and then look into the other things.
Mm-hmm. Well, remember, the heart is very important, because that's the one that's going to pump all the blood back all throughout your body. So thank you very much, Dr. Carr, for pointing that out. So after identifying all this problems in the heart, problems in the other organ system, what is the most common common outside or common dementia you see, sir, since we're talking about dementia?
Well, the most common of the dementias is Alzheimer's. Mm-hmm. It's actually a diagnosis of exclusion. Mm-hmm. The only way to positively identify Alzheimer's disease is with a brain biopsy, which of course no one is doing. So you eliminate the people who've had strokes. Those are called post-infarction dementias. The alcoholics, those people have dementias based on alcoholism. And then, of course, in this day and time, more and more, we're getting into people with substance abuse issues, the cocaine, the hardcore narcotics, the heroin. They end up in nursing homes, sometimes at a relatively young age. And then we have degenerative diseases, multiple sclerosis, amyotrophic lateral sclerosis, Huntington's chorea, diseases that become behavioral issues. And of course, people who have schizophrenia, they get older too as time goes by. And so
it can also cause dementia, right, sir?
Can be involved with problems of dementia, and dementia itself can also lead to psychotic manifestations, delusions, hallucinations, paranoias. Dementia, it starts as a forgetfulness, and of course a lot of long-term care people, we have people who will come to the facilities, check eyes, check ears, as people get older and their hearing isn't what it used to be and their vision isn't what it used to be, then their tendency toward hallucinations and delusions exacerbates, and they don't hear things like they should, or they are hearing something that didn't really take place. And so it becomes a very complex condition with a lot of manifestations, and it's a bit of a moving target. What starts out as a little forgetfulness then becomes to, I don't know where my house is. Mm-hmm. I don't know the way to drive my car home. This old phrase, old folks trying to get home before the sun goes down. Well, the reason they were doing that was because when the sun went down, they couldn't identify the neighborhood they were in.
That's true. I like what Dr. Carr said about having your eyes checked and your ears checked, because sometimes we just have to rule that out first in order for you to identify if it's a real dementia or not, or if it's just a hearing or vision problem. So thank you for pointing it out, sir, too. You mentioned about, again, Alzheimer's and Huntington's chorea. Is there a prevention for this, sir? Can we prevent it, or is it just a progressive disease? Or how can we really, I know we cannot stop it from getting worse, but is there a way to prevent it, sir?
Well, the main thing we do these days, frankly, with the baby boom population getting into a peak now, frankly, we're going to be dealing more and more with dementias and more with people who have these special needs. As far as preventing, I think the best things are to be socially active, either with your family or with, we have, most communities have senior citizen centers, and even in the psychiatric hospital I work in, there are on and ongoing activities every single day, and these activities, or they do word games, and they say things like, I graduated from, and they fill in the blank is high school, and this helps people to remember who they were, what they did in their working times, and so it's important. That and decent nutrition. Older people, so many times now, the children are spread all over the world these days with their jobs, and I have a whole lot of rooms with little old folks in them, and I go see them in those little rooms, but there's never anyone else there but that person. And before they get to the nursing home, they may be in their home, but shopping becomes a problem. Carrying groceries is a problem. It's always, to me, there used to be grocery stores, you'd had a strapping young fellow carry the groceries out to the car for the little old lady, which was a very nice thing. Mm-hmm. But then when the little lady gets home, he's not there. It's a problem. And meal preparation, you hear a lot of people who live alone, I don't want to go to the trouble of making a meal for myself. Hence, diet and nutrition become parts of the problem, and hydration part of the problem. It's easy for somebody to get up and go to the sink and get a glass of water. For some people who have a bad hip or had a knee replacement or may have had a stroke, and they're living independently, yes, but not doing very well, and even a simple, what we call ADL, activity of daily living, even a simple task like that becomes a major problem.
Mm. Dr. Carr covered a lot there, so let's just recap. First, he I don't know if you heard it, he pointed out the exercising of your brain. Second, your eating habits is very, very important. He also mentioned about water intake or dehydration, because that's very important too. And of course, the activities of daily living, how you move around. So it's very, very important that you focus on all of that. So thank you very much, Dr. Carr, for pointing that out. Any last tip for us, sir? I know you're busy, but Dr. Carr's a very busy man. So any last tip for us, sir? How can we prevent this? How can we prevent from falls and stuff, and stuff like that, sir?
Well, we have meetings, quarterly meetings, in the long-term care facilities. And I wish I had a way to tell you absolutely not to prevent falls. I was just in one of the quarterly meetings at one of the nursing homes, and one of the things we cover in every meeting are how many falls last month. And we are forever trying to stress, even in a long-term care facility, how to encourage a patient to hit the call button if they need to go from their bed to the bathroom, have someone come assist them. When it's cafeteria time, when it's meal time, people will come, and if you can only do a wheelchair, they will put you in a wheelchair, wheel you to the ask for help. And in spite of all of that, and in spite of the fact that these are staffed institutions, people still have falls. In spite of the fact we have dietitians and an entire cafeteria in each of these institutions, people still get dehydrated sometimes. We just try to do med passes, but if somebody is supposed to get an 8 a.m. medicine every day, well, it may be 7:30, it may be 8:30. It's not going to happen that it happens at exactly the same time every time for the same person every day. So there's a lot of difficulty in the best of circumstances. Of course, people should be careful not to have rough edges on furniture. People should be careful not to have throw rugs on the floors that might slip. People should be careful if you need a cane, for goodness sakes. These hurricanes, these 4-pronged canes are a nice thing.
You heard it from the doctor.
You can stand it up there, and unlike a standard cane, you have to find a place to put it when you sit down. And if you need a walker, for goodness sakes, take the walker with you. Do not have yourself tell you, oh, I can make it over there without the walker. The very time one does that, and they need their little button to push, I've fallen and I can't get up. We still have those people who I see in long-term care who came from an environment in which they were abiding, and they decided they could make it somewhere, or they didn't even think that. They were going somewhere and they had a spell and they fell. Or the hip decided to break on that day at that time. If someone has prescribed for you a cane or a walker, by all means, please use them.
You heard that. Please use those assistive devices. Call, don't fall. Again, thank you very much, Dr. Carr.
Thank you.
Where can we actually find you? Where's your clinic address here, sir? Would you mind sharing your telephone number?
This is the Weakley County Family Medicine. The number is 587-5353. And I give everybody this cell phone, 431-6473. That's how most people contact me, and that's kind of the way my life goes these days.
All right. Well, thank you very much, Dr. Carr. We will put all the show notes, the telephone number, Dr. Carr's phone number too, and his address in our show notes. Again, thank you very much, Misunderstanding Dementia Group, Alzheimer's Dementia Support Group. We appreciate you. But before I let you go, always remember the word FAST, F-A-S-T. F-A-S-T. First is find friends that will push you to your next level. Find people that will support you and bring out the best in you, because you are the average of the 5 people you hang out with. Right now, I'm hanging out with Dr. Carr. I know I'm going to be awesome because I'm learning from him, right? And letter A, you got to learn how to, letter A, take action. All this stuff that we're doing, this is all free. This is all free. All this video that we're doing, it's all free. And we're giving out to you, and that way you can take action. Because it's not going to do me good. It's not going to do Dr. Carr good if you don't take action. Take action. Go out in your community, like what Dr. Carr said. Go to a senior citizen center. Activities, and that way you're working out. You're doing the best that you can be. And the next letter, letter S, you got to learn how to shoot for the moon. Why? Because when you miss it, you're going to be eventually landing with the stars. I kept shooting for the moon. Guess what? I landed with a star right now, Dr. Carr. And last but not least, letter T. Letter T. Not time out, but teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. And that's what Dr. Carr is doing with us right now. He's teaching us. Why? He's got all the experience. he's got all the experience, and he's teaching us right now, and he's understanding it more. Again, thank you very much, Mr. Understanding Dementia and Alzheimer's and Dementia Support Group. We appreciate you. Thank you, Dr. Carr, for this time with you. I appreciate you. Thank you very much. Be awesome, be great, be excellent, and I'll see you around. Thank you, Dr. Carr. Appreciate you, sir.